Atomic Meso was a phase 2/3 study exploring the role of the arginine depleting agent Pegargiminase combined with chemotherapy, standard chemotherapy for mesothelioma with pemetrexed-platinum versus placebo and standard of care chemotherapy pemetrexed-platinum. It was focusing specifically on the most aggressive type of mesothelioma called non-epithelioid, composed of sarcomatoid and biphasic disease. So it's a global phase 3 study involving 5 countries: the US, UK, Italy, Taiwan, and Australia. The primary endpoint of the study looked at overall survival, and there was a statistically significant increase in the median overall survival by 1.6 months, from 7.7 months in the placebo chemotherapy arm to 9.3 months in the experimental arm of Pegargiminase, the arginine depleter, combined with standard chemotherapy. The secondary endpoint looked at progression-free survival. This was also met with a 0.6-month statistically significant increase in the progression-free survival. The study also looked at pharmacodynamic endpoints, which confirmed a decrease in arginine over the course of the study out to 25 weeks, with a reciprocal increase in citrulline, which is the degradation product of arginine. Immunogenicity was also looked at, and 98% of patients had an anti-drug antibody response. Well, importantly, Atomic Meso represents the first study of a novel anti-metabolite approach for cancer. So this was shown in the disease of non-epithelioid mesothelioma. So not only is this study positive and offers a new option for patients with an optimized version of chemotherapy, but also sets the scene for exploring arginine deprivation in many other cancers. And reflecting back on, this was a 20-year journey from the initial discovery in the laboratory to the phase 3, and also approximately 50, 60 years since the first amino acid was deprived in patients, and that was asparagine, using the drug asparaginase, which is now a standard treatment for particularly childhood leukemia. So this represents the second targetable amino acid which delivers on improved overall survival outcomes for patients in cancer. And this is the first disease we've looked at in a positive study with mesothelioma. There will certainly be more interest in exploring arginine deprivation in epithelioid mesothelioma in combination with chemotherapy, but our focus currently is exploring the role in another aggressive type of malignancy, which is small cell lung cancer. In the last couple of years, there's been an incremental improvement in the overall survival by the addition of anti-PD-L1 agents, such as atezolizumab, with the standard of care for small cell lung cancer, carboplatin etoposide, from 10 months to 12 months. We hope to improve that further by the addition of the fourth drug here with Pegargiminase, so a third modality with arginine deprivation. This study will be called Atomic Small Cell Lung Cancer, initially a phase 1 to assess safety. And if the study has shown that this treatment is tolerable, the study will then move into a phase 2/3 randomized in the way we've done with Atomic Meso.